You've been diagnosed with SIBO, small intestinal bacterial overgrowth. You were prescribed antibiotics, completed the treatment, the bloating went away, but a month later it came back. Another round of treatment, another period of relief. And so it goes in circles. Doctors don't understand what's happening, and you don't understand what's happening either. In this situation, I suggest looking for parasites, because SIBO and parasitic infections are very often linked, and it's quite possible that one leads to the other. And until you break this vicious cycle, the bloating will keep coming back because the SIBO will keep coming back. Here's how it works. The most common parasitic infections are caused by roundworms and Giardia. Roundworms live in the small intestine, right where the bile duct and the pancreatic duct open, where enzymes are released for proper digestion and for antiseptic purposes, to kill harmful bacteria in the small intestine. So roundworms cause inflammation of the mucous membrane with their toxins. The inflammation blocks enzymes, blocks the normal outflow of bile and pancreatic enzymes. What happens then? The flow of bile and pancreatic juice is disrupted, and bile becomes stagnant in the gallbladder. You end up with problems: bile stasis, flakes, sediment, polyps, stones on one hand, and on the other hand, the small intestine is left without enzymes and without its natural antiseptic. As a result, pathogenic bacteria are not killed and begin to proliferate. That is, they easily move up from the large intestine and colonize the small intestine, since there's a lot of food there. And there you have a recurrence of SIBO. On top of that, ascarids release special proteins that block your own enzymes, which are already in short supply. This is especially true, for example, of trypsin, which digests protein. So on the one hand, this protects them from being digested, and on the other hand, because the protein isn't digested, it starts to rot and you get bloating. And by the way, in such cases, the flatulence has an unpleasant hydrogen sulfide smell. What other parasites can live there? Very often, it's Giardia. They are protozoa, but they are also considered parasites. They live right at the very beginning of the duodenum, and by the way, can even penetrate into the gallbladder and even the liver. Giardia block the enzyme lactase, which breaks down milk sugar. Undigested lactose, milk sugar, becomes food for them and for pathogenic flora. A lot of gas is produced, you get bloated, and this bloating and flatulence usually don't have an unpleasant odor. So if you notice that you used to tolerate dairy products, but now you have developed an intolerance, look for Giardia. That's why antibiotics for SIBO may not work for long. You kill the bacteria, but the parasites remain. They continue to block bile flow and enzymes, and after a month, 2, 3, or even a week, a relapse occurs. What should you do? Get checked for parasites, do the necessary tests, and if something is confirmed, go through an antiparasitic program, either with medication or herbs, but always with proper preparation. In other words, if you have a parasitic infection, simply taking herbs or medication is not enough. It is absolutely necessary to prepare, heal the mucous membranes, restore bile flow, and recover enzyme function. Only after that do we treat SIBO, because these relapses often happen otherwise. If you want to untangle this complicated web of parasites, pathogenic flora, SIBO, and your bloating, I suggest you check out how I can help you under this video.